Hey everyone, it's Jason from Back in Motion in Newcastle and the Hunter Valley. Here today to go through some quick questions we often get about dry needling. So dry needling is something that physiotherapists, massage therapists, myotherapists and chiropractors do. It's often the best way I describe it. It's similar to acupuncture in that we use sterile single-use needles. However, it's different in that when we're doing dry needling, it's more from a Western medicine approach. So we're looking at blood flow, nerve changes, muscle contractions, rather than meridians and energy channels like acupuncture or Eastern or Chinese medicine do. So the first question we often get is, how does it work? And basically what happens is a few different ways that I like to think about how it works. So when we insert a needle into the muscle, it causes local vasodilation, or the blood vessels open up. And that increases fresh blood flow through that injury site or area, which may increase or help to increase the healing rate in those tissues. So for things like chronic tendon injuries, muscle tears, any areas with pain, any areas with muscle knots or tightness, that can help with that. The other thing it does is when we insert the needle and move it gently in and out or stimulate it, you'll often feel a little twitch or you feel the muscle sort of spasming and jumping. And that's all the little nerves firing off and making that muscle fiber contract around the needle. So the really great thing about that is a quick little bit of needling. So, a couple of minutes, 5 minutes is the equivalent of some really heavy, deep massage into there for about 10 or 15 minutes. And that's often why we get some post-needling muscle soreness. So similar to when you do a workout that you haven't done before and the next day you get that little bit of tight soreness in the muscle, you can often feel a little bit of that after needling. So either that night or the next day. That's why our therapists will often get in and do some massage in there to help loosen off the muscle afterwards. So we've got blood flow, muscle contraction, and then relaxation afterwards. The other thing is, because it is a foreign body, the body recognizes that and it sets off an immune response in that area that makes all the blood cells and immune cells go in there and start attacking old and nasty scar tissue and old cells. So it helps with that remodeling process. Those are the three main ones I usually like to talk about. There is some other theories about pain gating, about how it can affect the signals of pain coming to and from the spinal cord and in those areas. But I often find, because they are they're quite small effects and they're hard to see. Like when we put a needle into an area, we can see the blood vessels open up because the skin around it blushes. We can see the muscle twitch and you can feel it. We can even sometimes see like a little mosquito bite lump come up after we've taken them out, which is the local immune response and the histamines in that area. So I like to focus on those three because those are the really obvious and common ones we see. So other questions about it. How big are the needles? So I've got one here. I'm just going to quickly open it up out of the packet. So these needles, the common size I use are what we call a 50 mil needle. So the shaft of the needle, and they're really tiny. So I'm going to try and move it forward to the camera. I can't even line it up with it. So you can sort of see it there. It's super tiny. If I sort of line it up with my eyebrow or something maybe, it's really tiny. So the shaft of the needle that we can insert is 50 millimeters in these ones. Now they range in size between, I think, about 20 millimeters and up to 100 millimeters. In our clinics, we generally tend to use either 30, 50, 75 or 10. 30, 50, 75 or 100 millimeters, depending on the area that we're needling. Now, if you're in America or somewhere that uses an ancient system called inches and feet and all that, just, maybe get with the times and use a reasonable system like metric. I'm not going to try and convert that to inches for you. Needless to say, it's a lot less inches than millimeters. So it's going to depend on how deep we want to go and where we want to target. So obviously if we're needling into your hip, which is a big, massive muscle, we're going to go a lot deeper and probably use even a 10 centimeter one or a 100 mil needle, as opposed to if we were needling in through the front of the shoulder or in through your rhomboids, your upper trap, where the muscles are a lot surface, or even down here along our elbow. Those areas are a lot shallower that we need to target. So it's going to depend on our knowledge of the anatomy and where we want to target. As far as the thickness goes, we generally use 0.25 mil thickness needles in the clinic. Now, the reason for that is we want them to be as thin as possible so that they hurt less when they go in. And that's why we also spend a lot more money on expensive ones so they're sharper. Sounds funny, the sharper the needle, the less it hurts. But also we want it to be 25 mils, and you can get them as thin as like 0.15 mil needles. But the thinner they are, the more flimsy they are, and so it's sometimes hard to guide them in and stimulate the muscles. So we stick with the 0.25. The great thing about these needles is they are super bendy. So basically, if you do a muscle contraction around them, they generally will never snap or that. But they are single use. So they're always sterile, single use needles. We get them out of the packet, use them when you chuck them away. We'll send them to, be incinerated and gotten rid of in the appropriate means in biohazard ways. So, so they range in thickness. They can range in thickness, but generally speaking, we use the 0.25s. We use a brand called Red Coral. It's just one of the brands that I like to use. It's available here in Australia through our wholesalers. It's not the cheapest brand. We don't necessarily use that. We find that when we've tried to use cheaper brands before, they often can be blunter needles, or they don't feel as nice and smooth when we're using them on patients. So I would rather spend a little bit more to make sure we're giving you guys the best experience possible, because the more expensive needles just have that, like a lot of things, you spend a bit more, you get better quality in there. I'm not saying that the cheaper ones aren't sterile or that, but the more expensive ones do seem to be more sharper. Does it hurt? That's a good question. I wouldn't say it feels great. I mean, needles are never going to feel awesome. And I mean, I do think if people think needles feel amazing, I wonder about your sanity. But hey, in saying that, does it hurt like, oh my God? No, it doesn't. Often patients will describe it as surprising to us. We'll hit the spot and they go, ooh, that's, because the muscle jumps and it feels weird, it feels unusual. Often I describe it most like a dull ache, a bit of a dead leg or a dead arm sensation, and you feel the muscles twitch and kick sort of thing. You can also stimulate nerves with them when you hit it. So I always say to people, if it's more than just that ache around there, let us know. The other thing we can sometimes do is you can hit a little sweat gland under the skin. So we can't see it, we can't feel it, but when it hits there, it will sting when we insert the needle and the sting won't go away. So the problem with that is if it's still stinging after it's been in there for a while, let us know, because we can remove it out. You can pop it back in the same area and it won't hurt anywhere near as much. As I said, they're microscopic little things. What are the dangers with needling? So number one, infection. So whenever we do needling, we want to make sure you have nice, clean skin. In a physiotherapy clinic, I would say it's basically impossible to guarantee you're going to do it as a sterile procedure. We do it as a clean procedure. So we make sure we aqueum our hands, we make sure your skin's clean, but we can't guarantee there is absolutely no bugs or bacteria whatsoever. So we don't do it on anybody who's immune compromised post-surgery or that, because we don't want to have any risk of infection. The other risk, of course, is that we could puncture organs. So the main area that we see damage is pneumothoraxes, or air into the lungs. And that's often by needling down into the upper trap the wrong direction. So we always make sure we lift the upper trap away, because your lung is down in that cavity just in there. Also, the other areas would be down the back sort of thing. So making sure that you're needling appropriately in that area just to target those structures. That's why it's really important to only have needling done with somebody who is trained appropriately, not just somebody random in their back shed. So please make sure of that. The other small things that can go wrong is you can get a bit of bruising, like we can hit a little blood vessel under the skin. You won't even see it or feel it, but when we pull it out, you can get a little drop of blood or a little blood blister under the skin, a subdermal bleed that can result in a little beautiful coloured bruise that ends up usually being a 20-cent piece or something. Shoulders are really common for it. Elbows commonly get a little bit of a bruise on there. So those are probably the main issues with it, is the infection, the bruising. It's very rare that you are, if it's done properly, it's a very safe technique. So you shouldn't see that infection or any organ punctures. But bruising is, it does happen now and then sort of thing, but we really do try and avoid it where possible. As I said, we often do a little bit of massage after we've done the needling to reduce your post-needling soreness. We always encourage you to pop a heat pack on there when you get home, take a bit of Nurofen if you need to, sort of thing, if there is a bit of soreness. But it is a really great technique that can help you get moving better and feel good. If you'd like to find out more, if you'd like to get some dry needling done for your injury or condition, you can jump on our website, backinmotion.com.au. There's practices right around Australia. I'm based in our Newcastle, Hunter Valley and Port Stephens clinics. Otherwise, or you can give us a call on 4952 7033. That'll connect you through to us here in Newcastle, Hunter Valley and Port Stephens. and we'll be able to help you get some work done on your injury or pain. Thanks, and have a great night.